Good day to the viewing and listening public. Thank you for joining us for today's COVID-19 update. As usual, we will be speaking with the Minister of Health, Dr. Frank Anthony. The Center for Disease Control and Prevention announced earlier this week that they will introduce some new guidelines for COVID-19. One of these guidelines says that people infected with coronavirus will only need to self-isolate for 5 days if they are asymptomatic. Is this something that the ministry is looking to implement soon?
The CDC guidelines is based on what is happening in the United States. The dominant variant that is now circulating in the United States would be the Omicron variant. And with Omicron, people get infected. That infection, the most infectious period would be for the first 3 days. And then people become symptomatic in some cases. Some people would remain asymptomatic. But the duration of the illness with Omicron is much shorter. And based on those clinical parameters, that is why the CDC has changed their guidelines to say that persons would isolate for the first 5 days after being tested positive. And then on the 5th day, if they're asymptomatic, then they can come out of isolation. But however, they must continue wearing masks and so forth. So with the Omicron variant, that might be one of the things to look at. However, the variants that we have circulating here is still the Delta variant, and therefore we have to be mindful. At this point in time, those kinds of guidelines might not be applicable to us. If and when we do get the Omicron variant, we'll probably have to review within that context. Well, again, it's we want people to wear masks, wear them consistently. We know that surgical and procedural masks and N95 are much better than the cloth mask. So again, it's a choice that people have. So my advice to people is that if you believe you're at a higher risk of COVID-19 in the environment in which you find yourself, then you should wear that N95 mask or procedural surgical mask. If you are at a lower risk, then you can probably wear the cloth mask. But again, the cloth mask is not as effective because the pores in the mask are quite big, relatively big, and therefore viral particles can pass through if you're in close proximity with somebody who is infected. You will see more patrols, more joint services patrols, and we want people to be safe. So, we're asking the public to please abide by the rules, and once we do that, all of us would be safer. What we don't want is after these holidays that we start seeing an increase, a big spike in cases. If we do have that, then depending on how many cases, it can quickly overwhelm our system. So we want to make sure that we manage this properly, and to manage it properly, we need the public's cooperation. So vaccination numbers over the last 24 hours remain pretty much the same. We have seen more people coming out for boosters, but other than that, it's pretty much the same. So we've had, for adults, 410,825 first doses. That's approximately 80.1% of our adult population receiving a first dose. We have had 294,842 second dose vaccination being given. That's about 57.5% of our adult population. In terms of the 12 to 17, we have administered 30,317 doses. That's 41.6% of that age cohort as first dose. And then 21,652 That's about 29.7% as second dose to that age cohort. Booster doses, that has gone up a little bit. So we are now at 11,496 booster doses.
For more information, visit our website at dpi.gov.gy or any of our social media platforms. For DPI, I am Shukwan Gill.